Hello, I'm Deepika Rao, a PhD student at UW-Madison School of Pharmacy. My research is titled A Longitudinal Mixed Method Study of Changes in Medication Adherence Among African Americans with Type 2 Diabetes. I want to share with you a little bit of background before I begin discussing my study. African Americans are twice as likely to be diagnosed with type 2 diabetes than non-Hispanic whites and 5 times more likely to develop diabetes complications. They have 25% lower medication adherence. Research suggests that medication adherence is a dynamic process which changes with the social and environmental context of the patient. Therefore, it needs to be studied longitudinally. The objectives of our study was to first quantitatively evaluate changes in medication adherence and qualitatively explore the role of psychosocial and interpersonal factors on these adherence changes. Then, integrating the two, we wanted to explore the barriers and facilitators to African American patients' medication adherence. We used an explanatory sequential mixed methods design, which involves firstly a quantitative phase, followed by a qualitative phase, and then both results are integrated for the last phase. The qualitative phase are used to explain the quantitative findings. We conducted surveys at baseline and 6 months later at follow-up in the quantitative phase. We conducted semi-structured interviews to explain the findings from the surveys in the qualitative phase and integrated both using a joint display. The integrated theory of health behavior change informed our study design as well as data collection instruments. The questionnaire had a measure of adherence. Psychosocial factors measured were beliefs in medicines, self-efficacy, health literacy, and depressive symptoms. Interpersonal factors included illness perceptions, social support, and provider communication. We used a convenient sample of English-speaking adults who had type 2 diabetes and self-identified as Black or African American from 2 health clinics. Data collection involved 287 surveys mailed to eligible participants. All responders received the follow-up. In the qualitative phase, we conducted 10 60-minute semi-structured interviews. Data analysis included descriptive mean differential and bivariate correlation analysis, as well as inductive content analysis for the qualitative phase using in vivo. Here are the results of the study. I will first begin with the quantitative findings. These are all the scales that were measured at baseline and follow-up. Means and standard deviations for all scales are reported here. We also report correlations between the baseline and follow-up scores. Results indicate that there was a significant correlation between baseline and follow-up for all factors assessed in the study, indicating that there were changes occurring between the 6 months of baseline and follow-up, and these changes were related. Moving on to the qualitative phase. These are some of the themes that explain the results from the surveys. One theme was adherence memory methods. While some used pillbox, some used medications at the same time to remain adherent. An example of motivators for adherence, another theme, was knowledge. This patient checked the internet and looked at what people go through to remain adherent. Non-traditional form of social support was another theme, where this patient is talking about the senior center, which helped them with their diabetes and medications. Pill burden and complex medication regimens were some examples of negative themes. Patients were burdened by having to take more than one medication, or their complex regimen with 4 pills and having different doses confused them, which affected their adherence negatively. The joint display is a method of integrating the results from both findings. We see the first included integrated theory of health behavior model factors, the corresponding scores or the mean difference of the scores from the scales. The delta effect size is included because we had different sample sizes for baseline and follow-up. The corresponding matching themes from the qualitative interviews with the integrated theory health behavior model factors were included. We then had exemplar quotes of these themes. And finally, a meta-inference. What is the relationship between these quantitative and qualitative findings are explained here. We have included one example of a barrier for medication adherence, concerned beliefs, and a facilitator, health literacy. We see that the scores on concerned beliefs between baseline and follow-up wasn't significantly different. However, side effects was an important theme, an important concern for these patients. This patient was experiencing diarrhea from their metformin, which affected their medication adherence and reduced it. Health literacy was a facilitator. We see that there was a significant difference in the mean scores between baseline and follow-up of these patients. Access to health information was an important factor in improving this health literacy. This patient experienced classes, including nutritionist classes, that helped them focus on their adherence and self-regulating behaviors for their diabetes. Overall, this is the first mixed methods exploration of type 2 diabetes medication adherence in African Americans. We found unique psychosocial and interpersonal barriers and facilitators. The results indicated the need for a targeted and individualized adherence intervention for African Americans. Thank you for watching my presentation of my poster. Here is my contact information. We also have published a paper on this project. You can always access that. If you need any more information about this project, please don't hesitate to contact us. Thank you.